Melissa, it is called the prescription drug crisis that no one's talking about.
Well, tonight we are starting this conversation.
And News 4 San Antonio's Emily Bauckham shows you just what type of drug has doctors now just as worried as they are about opioids.
Benzodiazepines.
They work in the brain the same way that alcohol does.
It's a word psychologist Dr. Jason Miller says you're going to start seeing more often.
It's a big problem. I mean, it's right up there with the opioid problem.
These pills are used to treat anxiety. Common brand names include Valium, Xanax, Ativan. Dr. Miller sees addicted patients in his private practice and also right here on the street.
It's a vicious circle. So the person starts taking the medication because they're anxious. The medication, however, affects the brain by actually making you more anxious. So pretty soon people feel like without this medication, I'm anxious all the time, when in fact what they're experiencing is actually just the withdrawal from the medication.
There is a physical dependence that emerges.
Dr. Jennifer Sharp Potter says in this age of anxiety, the rate of people abusing benzos has gotten higher, particularly among college students, millennials, and baby boomers.
And when they use alcohol, the risk of a death is quite high.
A study published earlier this year in the Journal of the American Medical Association details what doctors call the next drug crisis. From 2005 to 2015, benzodiazepine prescriptions increased 50%. The study found more primary care doctors and surgeons are writing those prescriptions, not for anxiety, but for chronic pain, linking benzos to the opioid crisis.
1 in 3 of those overdoses involving opioids also involve a benzodiazepine.
Doctors say the pills are safe when taken as prescribed, but when people get addicted, the recovery is not pleasant.
It is dangerous to withdraw from them, so just to stop using is not particularly wise. You need to be medically monitored.
Because some people are going to have to do it inside of a hospital. They're not going to be able to do it on their own.
The medical study found there are surprisingly few guidelines for benzos, so if you use them and you have any concerns, it's best to have an honest conversation with your doctor. Emily Bauckham, News 4, San Antonio.